The common cold is an upper respiratory tract infection that affects millions of people throughout the year. It might not be the most serious illness, but it's definitely one of the most widespread. From the sneezing and runny nose to the fatigue and scratchy throat, colds can disrupt your daily routine and leave you feeling less than your best. In this video, we'll explore what the common cold is, what causes it, how it spreads, and most importantly, how to manage it effectively. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. The common cold is a mild viral infection that primarily affects the nose, throat, and sinuses. It's caused by several types of viruses, with rhinoviruses being the most common culprit. While the symptoms are typically mild, they can still be uncomfortable and inconvenient. A cold usually begins with a sore throat or an itchy feeling in the back of your mouth. Over the next few days, symptoms can progress to nasal congestion, sneezing, a runny nose, and eventually cough. Some people may also experience fatigue, watery eyes, and even a low-grade fever, although fevers are more common in children than adults. What sets the common cold apart from other respiratory illnesses like the flu is that the symptoms are generally milder and develop gradually. While a cold can make you feel tired and sluggish, it rarely causes severe complications. Most people recover within 7 to 10 days, although symptoms, especially the cough, can sometimes linger longer, particularly if you have a weakened immune system. Don't be surprised if your cough lasts a few weeks. To understand how to avoid getting a cold or spreading it to others, it's important to know how it spreads. The common cold is highly contagious, and it's primarily transmitted through respiratory droplets when an infected person sneezes, coughs, or talks. These droplets can land on surfaces or be inhaled by someone nearby. Colds also spread through direct contact. If you touch a surface contaminated with the virus, such as a doorknob, keyboard, or your phone, and then touch your face, especially your mouth, nose, or eyes, you can become infected. That's why good hygiene is so crucial in preventing colds. The virus is most contagious during the first 2 to 3 days of symptoms, but you can still spread even if you're feeling better. This is why it's so common for colds to pass through households, workplaces, and schools. Anyone can catch a cold, but certain factors can increase your risk. Young children are particularly susceptible because their immune systems are still developing, and they often are in close contact with others in daycare settings or school settings. Adults who work in crowded environments such as offices or public transportation hubs are also at higher risk. Additionally, people with weakened immune systems due to chronic illnesses, stress, or poor nutrition may be more likely to catch colds and have a harder time recovering. Now let's talk about what you can do to manage a cold if you catch one. Unfortunately, there's no cure for the common cold, as it's caused by a virus and not bacteria. Antibiotics are ineffective against colds, so treatment focuses on relieving symptoms and supporting your body's natural healing process. Rest is one of the most important aspects of recovery. When you're fighting off a virus, your body needs extra time to strengthen your immune response. While it can be tempting to power through your normal activities, taking time to rest allows your body to recover more efficiently. Staying hydrated is equally essential. Drinking plenty of fluids like water, herbal teas, and clear broths help thin mucus, making it easier to clear your nasal passages. Hydration also prevents your throat from becoming dry and irritated. Avoid alcohol and caffeinated drinks, as these can dehydrate you and potentially worsen your symptoms. To relieve nasal congestion, many people find steam inhalation or saline nasal sprays helpful. Breathing in steam from a bowl of hot water or taking a warm shower can loosen mucus and soothe your nasal passages. Saline sprays help moisturize the nasal passages and reduce congestion without the risk of rebound congestion that comes with overusing decongestant nasal sprays. However, decongestant nasal sprays, if used in short term, are very effective in reducing symptoms. For a sore throat, gargling with warm salt water several times a day can provide relief. This simple remedy reduces inflammation and helps clear irritants from the throat. Lozenges and honey can also soothe scratchy or irritated throats, but be mindful not to give honey to children under 1 year of age due to the risk of botulism. Pain relievers like acetaminophen or ibuprofen can reduce fever, relieve headaches, and ease muscle aches. Ibuprofen is particularly good for sore throat. Decongestants can be useful for reducing nasal swelling and improving airflow, but they should be used with caution and only for a short duration to avoid side effects. Cough suppressants and expectorants may also help, depending on whether you're dealing with a dry or productive cough. Always read the label carefully and consult with a healthcare professional if you're unsure which medication is right for you. What you eat and drink can also play a role in managing a cold. Foods rich in vitamin C, like oranges, kiwis, and bell peppers, may help support your immune system, although the evidence for vitamin C shortening colds is mixed. Zinc has also been studied for its potential to reduce the duration of cold symptoms, but it's most effective when taken early in the illness. Warm, soothing foods like chicken soup have been a go-to remedy for generations, and there is some science to back it up. The warmth can help clear nasal passages, and the nutrients in the broth can provide comfort and nourishment. While colds are common, there are steps you can take to reduce your risk of catching one. Washing your hands frequently with soap and water is one of the most effective ways to prevent the spread of germs. If soap and water aren't available, using an alcohol-based hand sanitizer is a good alternative. Avoid touching your face, especially your eyes, nose, and mouth, as these are common entry points for viruses. When someone around you is sick, try to maintain a bit of distance and disinfect frequently touched surfaces regularly. Boosting your immune system through a healthy lifestyle can also make a difference. Eating a balanced diet, staying physically active, getting enough sleep, and managing stress all contribute to a stronger immune defense. Most colds resolve on their own, but there are situations where medical attention is necessary. If your symptoms last longer than 10 days, worsen after initially improving, or are accompanied by high fever, difficulty breathing, or severe fatigue, it's time to see a healthcare provider. These could be signs of a more serious condition such as the flu, sinus infection, or pneumonia. Children, older adults, and people with underlying health conditions should be particularly vigilant. For example, infants and toddlers can become dehydrated quickly, so it's important to monitor their fluid intake and watch for signs of distress. The common cold may be a universal experience, but it doesn't have to derail your life. Understanding the symptoms, how it spreads, and how to manage it effectively can make a big difference in how you feel and recover. By practicing good hygiene and taking care of your body, you can minimize your risk of getting sick and bounce back more quickly if you do catch a cold. Thank you for watching. I hope you found this information useful. As always, take care of yourself and make the most of your day.